Hey, right. Hello, Sarah. It's good to see you again. Thanks for joining us. Welcome, everybody, to WBC HOSP today. I'm chairing today, even though I'm not feeling very good. We do have a few apologies today. Unfortunately, David Hare's not available, and unfortunately, Andy Croy is not available. Did we receive any other apologies? Just David Hare. Okay. Does anybody have any questions about the previous meeting minutes? Do we need to vote on that, or
Just a show of hands if everybody's happy.
is everybody happy with the previous meeting minutes? Have a show of hands. That's unanimous. Thank you. Do we have any declarations of interest? No declarations of interest. Did we receive any public questions? No. Are there any member questions?
No.
No. We have three items on today. Madeline is also unfortunately ill, and Madeline is going to prepare a short statement for me to read out in relation to PERDA. But basically, this is going to be quite a short, sharp meeting, and there's going to be nothing controversial in this meeting. So I would like to start with the first item, which is NHS continuing healthcare. Is that you, Sarah, that's going to be presenting?
Yes, it is. Thank you very much, Chair. So I'm Sarah. I work for the NHS Integrated Care Board, and I'm the lead director for what we refer to as Berkshire West, which covers the areas of Wokingham, Reading and West Berkshire local authorities. And I'm just going to give a quick update on the work we're doing around NHS continuing healthcare. I came to this meeting a couple of months ago and wanted to come back and give a progress update, and then also give some assurance on the ongoing kind of assurance and scrutiny that we arrangements that we've put in place as well. So a reminder for members, so NHS continuing healthcare is where an individual requires an ongoing package of health and social care that is funded solely by the NHS because it relates to a primary health need that is confirmed through a process of assessment, and it's not condition specific, it's sort of care needs and individual specific, which is why the assessment process is so key in determining if someone is eligible for continuing healthcare. So when I was last with you, I gave an overview of the work we're doing now that we are an integrated care board to look at our continuing healthcare processes and ensure that they are consistent and optimised across our entire geographical patch. So I'll give an update on some of the key areas that have progressed since then, and then explain how we're going to be overseeing this work going forwards, and then with the Chair's permission, open up to some questions if you have any. So first of all, we were looking at our operating model, so how we are delivering our CHC service, and we have considered a number of options and agreed our preferred option of delivering the CHC service for the entire Berkshire West, Oxfordshire and Buckinghamshire footprint in-house within the ICB. So our next steps are to bring the team in Oxfordshire into the Bob ICB team. We are planning that process at the moment, and that will be in place from the 1st of July. That gives us the opportunity to really integrate our ways of working and learn from each other and learn the best practice across the patch. Secondly, we were looking at capacity within our leadership team, both across Bob and here within Berkshire West. And I'm delighted that we've substantively recruited to a Deputy Director of Continuing Healthcare post, a lady called Liz Hodgkinson, who joins us from the NHS England Central CHC policy team. So she brings a real wealth of knowledge into our team, and we're absolutely delighted to have her. She's been with us for 3 weeks now, so it's early days, but one of her first tasks is to review all of our policies, starting with predominantly our disputes policy, to ensure that is really clear and provides a clear process for our teams when we are looking at potential funding disputes, to make that process as seamless as possible if it does come to that. Another area we've looked at is around education and training. So we want to make sure that all health and social care practitioners and members of the public are aware of continuing healthcare and when people may need to be referred into the assessment process to make sure they can access this funding. So at the moment we have an education and training sort of working group established across the BOB, Berkshire West, Oxfordshire and Buckinghamshire footprint that has local authority representatives on that group, and they're currently scoping out what education and training is available for both health and care practitioners and where there are any gaps, and therefore what we might need to put in place to address those gaps to make sure that we are getting all of the referrals in that we should be. So that work is in progress, and then we'll be determining what actions are needed on the back of that scoping exercise that's ongoing at the moment. And then I also mentioned when I was last here, it's not strictly continuing healthcare, but it's related. So we're looking at our joint funding policy here across Berkshire West. So if an individual isn't deemed to be eligible for full continuing healthcare, but some of their health needs should be funded by the NHS and some potentially through the local authority, we wanted to clarify the process and the policy around agreeing that. So we have been jointly funding care for, well, that's a process that is in place at the moment, but we don't have a clear and agreed policy. So we've been working on that, again, a working group with representatives from your organisation as well as Reading and West Berkshire and my organisation, the ICB. We've come together to review and agree a policy, and we are at the point of signing that off within the next week and looking to then roll it out from mid-April. So that's made some really good progress there, and hopefully that will add some clarity to all of our practitioners working in this area, and for those who are on the receiving end of the process as well. In terms of ongoing oversight, so we have a transformation board that's been established. That was established shortly after Bob as an ICB was formed, which is chaired by our Chief Nursing Officer. I attend that board, as does Matt Pope, your Director of Adult Social Services. And so that is the Bob-wide board where we're making sure we're making the progress that we want to in all of the areas of this programme of work. We've also been discussing this at our kind of Unified Executive Officer group here in Berkshire West. So that's a group that is attended by Susan Parsonage, your Chief Exec, and again, Matt Pope, your Director of Adult Social Services. And CHC and joint funding is one of the emerging priorities that group will be looking at as well. So providing appropriate oversight into the progress we're making there and making sure it's delivering what we want and need it to on behalf of our residents. And also going forwards, the work of that group, the Unified Executive, will be feeding regularly into the Health and Wellbeing Board. So another opportunity for public and member scrutiny of the progress we're making there. So that's covered quite a lot, but I really hope what this tells you is that we're really focusing on this. It's an area of priority, and of equal importance is making sure we're as open and transparent about the work that we're doing, and it's sort of done together as opposed to by one organisation. So I will pause there, and thank you very much for inviting me back to provide this update.
Thanks very much, Sarah, for the update. Do we have some questions? Any questions? We don't really have any questions today. The intention really for this meeting is to be a short meeting, and hopefully that'll give you back some time. But we would definitely request an update from you in the future when the transformation programs and the Wellbeing Board and the increased transparency are in place. And we look forward to seeing you again. Thank you very much for your time, Sarah.
Thank you very much, everybody.
Bye-bye. Right, I think the next item is the adult social care. Is that you, Wes?
It's transformation plan within
Yes.
Yeah.
Chair. Well, Wes is doing that. Which it's on the step.
Sorry, just mute you.
just while he's sorting that out, I didn't realise there were 2 sets of minutes to approve at the start.
I didn't see that.
No, the 25th were fine. The 17th, my apologies are missed off, which I sent actually to you,
Yeah,
and you forwarded them on.
we will rectify.
Thanks.
Apologies for that.
So it happens.
Oh, echoing, great. Okay, so Ingrid and I are going to tag team this one. And what we're doing today, so this came off the back of management committee asking us to come here and present some information on the adult social services transformation programme. So today I'm just giving an overview of the breadth of our transformation programme. Obviously, are there any particular areas that you'd like us to focus on at a previous date, a future date? We're more than happy to do that. So in terms of the adult services transformation programme, we've got one single bit of governance which manages the whole programme. But there are multiple streams underneath that, which I'm sure you can imagine crossover, and there's some interdependencies between those programmes. And they're broad ranging from health and wellbeing board activity through to the WIP. We have some very specific adult social care transformation programmes, and then work around our strategic partnership with Optilis and how we develop that. Ingrid, at this stage, can I hand over to you to run through the health and wellbeing element of it?
Yeah, absolutely. Good evening, everyone, and apologies, I'm not there in person. I have 3 small girls in bed upstairs, and I'm here on my own with them. So to update you around our health and wellbeing strategy. So it was now in December, just over a year ago, that the health and wellbeing strategy for Berkshire West was approved. Now, that was not done lightly, and in order for us to approve that for us here in Wokingham, we added, as you will see, our own Wokingham strategy into action priorities. So you will see the P1, P2, P3, P4, P5 across the top are the very broad priorities that fell out of the health and wellbeing strategy process. Those were really, as you can see, very high level. So supporting good mental health and wellbeing for adults and children, for example. But really what we then did as a wellbeing board with partners was to work through the data for Wokingham, the needs of our residents, and come up with our very specific Wokingham priorities under each of those. And those are the ones listed under projects. So you'll see, for example, in reduced the differences in health between different groups of people. For Wokingham, our focus has been, or is decided to be, cardiovascular disease, cancer and COVID recovery. And you can see that across each of the priorities. So this was adopted or agreed, let's say, at the wellbeing, as I say, in December, just the year before last. And we have been working with colleagues across the Wellbeing Board, which is obviously a partnership board with lots of people relevant to these strategic priorities on that board. So we have an action plan around each one of those project areas, and we have, I'll show you in a second, the governance and delivery structure for each of those. Oh, thank you. So but previously, at the agreement of this strategy, we had the Wokingham Health and Wellbeing Board as a single board, and we had underneath it some of the boards that you see there in blue. So we had Community Safety Partnership Board, and we had the Wokingham Integrated Partnership Board, and we had the Physically Active Communities Action Group and the Young People Partnership Board. So looking at what structure we had, working with the board, we felt that we needed additional reporting groups into the Wellbeing Board in order for us to really oversee the activity and the outcomes related to those projects and priorities. It was also felt that the Wellbeing Board, as a public meeting, with some of the papers that was required to see and asked to see from a broad range of people, probably wasn't the place for detailed activity oversight and delivery oversight. So what we'd set up was a steering group which sits, it's the same membership of the Wellbeing Board, but the Wellbeing Board happens alternate months, and the alternate months is the steering group, which is much more business focused. So it's much more looking at the activity of each of those partnership or task and finish groups, I guess, or action groups. They've all got different names in the blue underneath, and each one of those has ownership around the projects that we saw on the previous slide. So we have a much clearer structure for owning some of those priorities and delivering against them, and a clearer governance structure for hearing about that activity, overseeing it, and indeed helping. So often we have found the steering group has become quite a discursive forum. So when people have challenges or barriers around some of the work they're trying to do, they bring that to the steering group, and those in senior positions on that steering group have been able to help navigate some of the work and assist people in achieving some of the things they're trying to achieve. So it's been a really helpful new group, I would say. So we obviously have the Community Safety Partnership Board, and that reports into the Wellbeing Board. We have a Learning Disabilities Partnership Board as community. The learning disability community is a priority for us in Wokingham. Social isolation and loneliness action group focuses on some of the adult mental health and wellbeing actions and projects. We've got the Dementia Steering Group and Dementia Alliance, which works closely, obviously, with the Carers Strategy Action Group, where we have an overlay of dementia and their carers. But those are obviously separate groups, and both report into the steering group, owning the projects and the priorities around our residents with dementia, and then obviously our carers who are looking after people with dementia, but also other carers. Wokingham Integrated Partnership Board, I'll come on and talk to in a minute. And then we have Physically Active Communities Action Group. That doesn't relate directly to the priorities from the Berkshire West wellbeing strategy, but it was felt quite strongly both by public health, myself, and by the wellbeing board members, that actually for us in Wokingham, having the Physically Active action group was a really important one for us to continue with in terms of working in partnership for the to promote physically active communities within our borough. And obviously Children and Young People Partnership Board. So for the first time, our previous wellbeing board strategy didn't have children and young people priorities, and this one obviously has 2 out of 5. So there really has been an increased prominence of Children and Young People Partnership Board reporting into the Wellbeing Board, which is very welcome and has been really great to see, as they also strengthen some of their governance around the work that they're doing. That's the end of the Wellbeing Board. I don't know if we're going to take questions as we go along, or whether we should plough on. I don't know. What would Chair, what would you prefer?
Any questions so far? Or... I don't think so.
No, I think, as Wes has pointed out, we are very happy to come and talk more about any specific area. So this is really a very broad overview, and there is, as I said, a programme of work under each of those priorities. So very happy to come and do a more detailed presentation about any area that we cover this evening. So I'll keep going then into the Wokingham Integrated Partnership. Now this...
Sorry, Ingrid, I think...
That's what...
I think Rebecca has a question.
Yeah. Okay. I remember strategy in action being described to us before, and reporting was not established. Can you update us on the schedule for performance reporting to this committee for each priority? Thank you.
Yes, absolutely. So we had a previous wellbeing strategy before this one, obviously, and then it's gone into this. That came to an end, and we've adopted this new one. The strategy into action is really the title that we give to the translation of that broader overarching strategy into action. So it's the same type. We had one before, and we have the same another strategy into action for this strategy. It's just that kind of term of the delivery, and when I arrived was sort of towards the tail end of that strategy into action. There really wasn't any structured reporting, as you point out. That has been totally transformed since we've adopted this new strategy. So in the last 18 months, with this new governance structure, where we have a steering group that completely oversees the delivery around the priorities, we do report on the programme delivery, on the programme outcomes quarterly. So each one of those groups in blue reports quarterly to the steering group on their activity and on their outcomes, and they do that in a sort of rolling rota, if you see what I mean. So we have the steering group every other month, and then half of the groups do it 1 month, half the other. So we get quarterly activity and delivery reports to the steering group. If anything is seen that is either to be demonstrated in terms of best practice or of concern, we can always take issues from the steering group into the Public Wellbeing Board for further discussion, or indeed to shine a spotlight on things. So that's working well. Each group is led by a different team, some of them co-chaired with external partners, some of them co-chaired with different directorates internally, but they are all kind of partnership and complex, really, boards in terms of what they're trying to do across different partnerships. But they are now all well established, and I think that some of them you've probably heard from here, indeed around maybe the carer strategy. But again, I can bring some of the detail, very happy to. But yes, that governance, reporting and structure is well in place now and is working well.
I think we have a question from Rochelle.
Yes, I've noticed your integrated partnership board doesn't include ARC, which is the counselling service that's provided in supported by Woking Borough Council. You only have Mind. Is there any particular reason you haven't included ARC? Because they provide help as well. And since we're already paying for them, partially at least, it would be useful to be using them as well and integrating them into the partnership board.
Yeah, thank you. So the Integrated Partnership Board, which maybe we'll go on to now, please, Wes, is limited in some respects by the people that we have around the table. Now, the project delivered here, there are different elements to mental health. So we have the Community Mental Health Service, which is different to Wokingham Integrated Partnership. So they are two different parts of our support for residents, and ARC falls under the Community Mental Health Service, so it's not under the WIP as such. Mind doesn't sit on the board. It is a project that the board that delivers to the board. So the partners that sit at the board are the ones in the little circle here at the bottom left. So we have involved there representing the voluntary sector. Health Watch sit on the Integrated Partnership Board, and then our health partners, so from the BHFT and RBH, as well as community Wokingham Borough Council and our primary care trust. So each of our clinical directors from each of the PCNs also sit on the Integrated Partnership Board. So it's really a very health and local authority integrated space with voluntary sector and Health Watch representation as well. So that's where the board members come from. It is every local authority, as you all know, has an integration board, and what we do is, in a large part, oversee the administration and spend of the Better Care Fund, which is a fund from health and local authority funding, which seeks to, at the bottom there in the top left box at the bottom, support essentially try and avoid admissions into hospital, and then support people being discharged from hospital. That's the two main areas of work, and then they also do work based on reducing health inequalities. So those are the kind of three main areas. Whenever we're looking at the work we do, it has to fit into those priorities. The reason we have to fit them into that's the aim of the Better Care Fund, but also the areas of work around the Integrated Partnership Board are governed by NHS England, and there is a return that we need to fill out showing exactly what activity we have done against each one of those and return it to NHS England. So it's quite a closely regulated area of work of health and the local authority working together. It is also the primary forum for the local authority to interact with PCN clinical directors. So they do come there. It's not in any way essential. There's no rule that they have to come there. They come out of willingness. And it is a place where we do joint working and try and support our clinical directors as they face obviously very difficult circumstances. So in terms of demand, and we try and help them under those categories, try and help sort of support and avoid demand in primary care as well as in secondary care. So really our strategic aims listed there on the right hand side are to really keep our residents as residents rather than this translation into patients as they go down the line through a kind of primary and secondary care route. We want to keep people as residents for as long as possible without that kind of becoming a patient and then looking at discharge back into the community. We want to reduce the number of people that have high level support packages, and there's lots of ways of doing that, but perhaps looking both before people go into hospital but also on their way out from hospital. We want to try and be proactive, so find and support people before they become high risk, and obviously meet the Better Care Fund targets, which are set for us by NHS England. And then, so you can see some of the projects being delivered in this area. They are quite specific because of the kind of specific governance and regulation around it from NHS England, but we are working on, for example, improving the uptake of learning disability health checks, implementing primary care network social workers, and you can read the list there. So very different things, but all aiming to do what the BCF fund aims to do, which is this admission avoidance and supporting discharge. So that's where you'll see though that obviously there's a lot of overlap, obviously, because it sits under the Wellbeing Board. So the WIP reports and is governed by the Wellbeing Board. So we try to align the work that needs to happen in the Integrated Partnership Board with the work of the Wellbeing Board. So there is complementary programmes of work, I hope you can see, as should be the case. If there's any questions about the integrated partnership space?
Jill asked, what about young people and young adults? ARC provides most service for the NHS as well as for the local area for young adults, and you seem to have not included anything about young adults and young people, because getting them, providing them with ways to actually deal with some of the mental health issues might help them so they won't go into this other part when they get to be adults. It just seems like they should be included in this.
No, thank you very much, Councillor. So the Integrated Partnership Board is an adult space. The Children and Young People Partnership Board is the equivalent for children. So this is an adult space. We do get an update from the Children and Young People Partnership Board because there is the similar frustration that you have just expressed from obviously the clinicians, the clinical directors of the PCNs who see patients obviously from cradle to grave, and they don't make this distinction between adults and children in the same way that we do. But this is a pot of money, the Better Care Fund, but also a partnership board that is focused on adults, which is why it looks like children's are missing. They're not missing in the round. It's just that they have a separate partnership board that governs all health and wellbeing things related to children.
Okay, so again, just this is an update overview of the adult services programme that we have, and this is just really to illustrate the breadth of our programme, and we've got a lot on in terms of our priorities at the moment. So these are some of the change projects that we've been working on in the recent years. So we've done a lot around co-production and the social care vision, bringing in social care futures. That's something that will come at a future meeting around social care futures. The adult social services workforce strategy, going left to right, it's probably not helpful. I'll start again and carry on going down the line. So the charity in the community hub, we've seen that at Waterford House and bringing charities together. Recovery College has really come as part of business as usual now. So around being the best we can, we've had the workforce strategy, which is looking at both ourselves in adult services, and how we support recruitment and retention into adult services, but also the wider sector and how we can support the care sector in terms of workforce recruitment and retention. We've done a lot around strengthening our approach to contract management and how we manage the commission services that we have in adult services. We've put in systems in place. We have a new contract management framework around how we support providers. And we've done a lot of work around implementing strength-based practice. Specialist accommodation on the right around improving outcomes. I'll do a bit of a spotlight very quickly on the next slide, but this is around how we can support people with learning disability and mental health live in the community and access accommodation at the right place at the right time to support them to improve their needs. We re-procured the carer service really co-produced the development of the new service, and we've just commissioned that. Ingrid talked about the Learning Disability Partnership Programme and improving transition to services there, and also the LD strategy, which we delivered previously. So moving on.
Can I ask a question on that?
Of course.
With regards to the workforce strategy, I did, I'm like a broken record. One of the things that David Hare is always saying, and he said at full council the other day, is Ophthalis is always got recruitment and retention problems. So one of the things that I raised actually with Rachel Bishop-Firth as well was the idea of some kind of subsidised creche. And the feedback that Rachel Bishop-Firth gave me was that obviously a lot of the time workers tend to be female and they tend to be child carers, and having young children can be a time which drags people, particularly females, into poverty type scenarios because of the cost of childcare. So one of the things that I asked Rachel Bishop-Firth if we could get is onto the workforce strategy, some kind of evaluation for a subsidised creche for the Ophthalis workers and the WBC workers. And we have 3 children. When our children were small, I remember the costs of childcare were enormous, and if I was a carer working for Ophthalis, my finances would be massively affected by the caring costs if I had children, with carers. So I would just like some kind of evaluation as part of that workforce strategy.
Okay, I would say just one thing. Obviously, Ophthalis is our strategic partner in terms of adult social care, but they're one segment of the market, and the whole workforce across adult social care is suffering. That goes back to the historic level of underfunding in the sector.
I mean it for everybody.
Sure. I'm happy to schedule the adult social services workforce strategy for a future meeting, and I could pick up that point. Yeah.
I mean, not to put a finer point on it, Ingrid said she can't be here because she's got no carer for her 3 small children. And, I know my wife has been in the same position many times. It's always normally left to the female, which creates recruitment and retention problems for most organisations in my experience.
Okay. Moving on to, so was there a question?
Or did you want a question, Alison?
Yeah. Okay. So just one project we wanted to highlight, which has reached the conclusion of its first stage, is around the specialist accommodation project. And in the bottom right-hand corner, you can see some pictures of some accommodation that we've recently built in the local area. And that's really been, again, supporting people with learning disability or mental health in the community. And we've managed to establish over 30 new households for people locally in the local area. And this has really seen a real improvement in quality of life, and key performance indicators around people living in their own home has improved. And you'll see that we're currently up to 94% of people, the indicator there. And there's also additional benefits this has brought around climate change, for example, and the utilisation of certain technologies within this scheme. And I think ultimately it's been a fantastic piece of work of bringing together both housing, the council, and Ophthalis as a. Yeah, sure.
Yes. While you're talking about the housing, out of interest, how much is it's full? So have you got waiting lists? How many people actually need these places?
So we have a list of people who are currently transitioning to adulthood. That's about 5 a year. So that list will keep going. and we'll carry on rolling. Number of people waiting is very high, and off the top of my head, I'm going to get it wrong. But I think that there is a large list of people, and we do need more assets to accommodate more people in the local area to live in their own home.
Because I was going to say there's a lot of people that still live within the borough, within institutions as such, as we know, don't we, that could potentially do very, very well living in this kind of accommodation.
Absolutely.
And you know, I know I worked a long time ago with adults with learning disabilities. So, you know, looking at these facilities, they're absolutely amazing, but there's not many people that are benefiting, is there, at the minute? Well, it's great that it's a start.
Yeah, I mean,
you know.
you're right. There's, in terms of old-fashioned registered provision, some of this accommodation has accommodated people in a different way to live in this supported accommodation. There's been other people who have been living with mum and dad, and it's been right for them to move out. And there's been people in unsuitable accommodation, to put another way, that have moved into here. We have a programme. We've just completed a review by the LGA. I've just done a review of our first stage and said what's gone well, what hasn't gone so well. It's, you know, we've had issues like every programme, but you know, that it is fantastic. I think you can see on the right the mental health flats, and on the left there's some learning disability accommodation. But we've learned we need more cluster flats. It's really hard to get people to live together in a house, etc.
And interestingly, have you got any future plans? What are the future plans coming forward for additional projects?
So we have a capital programme around future projects. So we've just completed the evaluation of the phase 1, and then we'll move into a phase 2 of designing what we need going forward and learning of it. So again, an example is right at the beginning, we bought houses and adapted houses, and it's hard to get 2 people to live together. It's you know, cluster flats are better. So we're taking this opportunity to take that learning and then going on to the next stage. But ultimately, we need additional property, and we'll work with our colleagues in assets around obtaining those right properties to support people to live in the community. But it is a real fantastic project. You go there and you talk to people who are actually living there, and they talk about going to Sainsbury's for the first time on their own. And it's a real positive in terms of the outcomes that people are seeing at these properties. Yep. Okay, so I'll move on to Optilis. Yeah.
So obviously, many of these projects are to, you know, prevent, reduce, delay the need for ongoing care. So, what are the budget implications of implementing the programs? Is it positive or negative?
Would it be better if I come back and talk about the specialist accommodation project in depth, or today sort of providing an overview? I don't have the figures. So overall, I think we've got a lot of cost avoidance, because again, these are people that may be living with mum and dad, so they don't currently have costs. So we're accommodating them and supporting them to live in the house with Optilis supporting them, which will cost us less than going to the private sector. And we are also creating the environment for people to live in their home independently. I don't have the figures on me at the moment, but I would say it's probably cost neutral in terms of
so these transformation strategies, are they driving efficiencies?
Financial efficiencies, there are some with the housing. Another fundamental benefit as a transformation programme is they're creating the right homes for the right people at the right time. So the financial element is one bit of it. It's the benefit that this is also created by giving people their own homes to live in and the right condition of accommodation and supporting them to be independent. So I guess those two things need to be weighed off against each other. I think, broadly speaking, it's not cost a substantial amount of money. We've been able to contain costs by working very closely with Optilis. But again, if you would like me to come and talk specifically,
I mean, Wes, we always like numbers. We, you know, half the people are accountants. So, you know, if we could take that as an action for a future meeting, that would be great.
Yep.
But I mean, one thing that, you know, we want to consider also is the social aspects.
Yeah.
And, you know, obviously, if we're getting the right person in the right place at the right time, that's also potentially saving us some potential future cost, which is rather unquantifiable.
Sure. We're currently working with a a company around some videos putting together, because that will support people moving into accommodation as well. So we could potentially bring those as well and show really the user experience and what people are saying about their life experience, you know, coming from living with mum, and that independence that this accommodation has brought individuals is really powerful. So I'm happy to bring those as well.
Well, I think, would the committee like to see one or two of those little videos, or? Yeah,
Once they're made.
yeah. Not right now.
Well, not right now. I met the film guy this morning, so.
Sorry, just to add it, I think it'd be interesting to know kind of as well the facts with how many people are waiting for these, you know, what are the lists like? How many people have we got in the borough that needs accommodation moving forward in the future?
Yeah.
Those sorts of things coming back to us could be really useful, because I mean, I actually think the savings might not be seen now, but in the long term, of where the big, which is exactly what you said, you know, people when unfortunately they don't have their families around to look after them in the long term, where the big savings, though it shouldn't be about savings, it should be about learning and, you know, living independently, but there are some big cost implications coming down the line for some of these people, so it would be interesting in the long term to see those sorts of figures.
I mean, because, you know, if we're being more efficient, then we're going to be able to help more people, you know, rather than only, you know, prioritising our most vulnerable is important. But, you know, we've got people who, I can't think of the phrase here, but they're not the most vulnerable, but they certainly are vulnerable and need our help. And you know, when the budget is tight, we do have to make sure it's just directed at the most vulnerable. But if we can be more and more efficient with that, then we can help more of our residents.
Just to follow on, we're all corporate parents, so are any of our children leaving care involved in this project?
In these particular, I am not aware of any that are leaving care. No, there aren't. It's not to say they wouldn't not be if the right accommodation was for them, but there's not any currently that have been accommodated amongst that group. Just going back to it, I mean, we talked about Optilis that's next on the slide. I think a real benefit of the supported living programme that we've got, specialist accommodation, is working with Optilis. Again, some of these efficiencies will come over time. If you place with provider X, there's no incentive to change, and we will see those efficiencies long term. Again, going back to it, I don't have the figures on me now, but these are cost avoidance, a lot of it, from people coming from their home to their transition to adulthood, and they're going to be living in a house, so they don't have costs to start with. Now we know that we get the longer term cost benefits. Yep. Yeah. So in terms of Optilis, so moving on to Optilis then, here are some elements in terms of the transformation programme we've worked in developing Optilis. We most recently transferred Loddon Court respite services over to Optilis, and that happened a number of months ago. We've also transferred supported living accommodation with them. So we've worked with them on the specialist accommodation project to support the development of the business and support people through that. Community Lives is a programme that they've established around supporting people who are accessing community services in a different way. They're a provider of last resort, or they support us in terms of developing the market and supporting the market. They're rolling out an access system, which is a care planning system, which will create efficiencies because they move them in terms of the technology and the way that they can rota, etc. Will create greater efficiencies. Program around travel trainer. That's how you support people with learning disabilities to get from A to B in a different way. Home First initiative around hospital discharge, and they're still maintaining that getting to good in terms of CQC.
Sorry, I can ask a question on discharge. Sure. I know Matt did some very good work a couple of years ago on discharge from RBH primarily. Is that the same thing as this, or is it different?
It's different. So in terms of hospital discharge and how we manage hospital discharge, we have we work closely with Sarah in terms of our programme, and we commission blocks in terms of care where people are discharged from hospital from, and that replicates the funding cycle that central government goes through in terms of the programme. So current funding cycle's up till the 31st, and we had a number of commissioned services to support hospital discharge through that locally. And that would either be different pathways, so it would be people going home and how we support people at home versus someone who goes into a care home and how we support them in a care home. Thank you. So in terms of what's coming up, so this is our programme going forward. There's obviously a lot of information there. It's very small on the screen, so I'm not sure you can even see it. But on the right-hand side, I'll do that, and then I don't know if Ingrid wants to jump in. We're looking to refresh our adult social care strategy and really bring in social care futures, which we talked about before, which is a movement around social care. CQC inspection, government's calling it assurance, but we're going to be inspected from next year. Pathway redesign, we've got two bits of the function that's somewhat separated. We're looking at our strategy. Reablement, so that's supporting people in the community. We're looking at our current offer there. Increasing our capacity around dementia care in the borough, and that's a really important element around how we support the capacity in the sector. And we're reviewing self-funders, so we're doing a piece of work around understanding our self-funders a bit better. And then finally, we talked about the autism strategy last time. Optilis, again, they're looking at Loddon Court, so we transferred it to Optilis, Loddon Court to Optilis. We're currently going through a programme of refurbishing that facility, making it more attractive to younger people to access a respite provision. There's not a lot of respite provision locally, and this is about creating the right respite that can support people again at the right time. Extra care capacity within the market and the residential care, and then overseas recruitment, retention we talked about earlier, workforce recruitment and retention, and how we could work with Optilis to support their workforce better. Ingrid, I don't know if you had anything that you wanted to just highlight on the health and wellbeing or the WIP side.
Yeah, thank you. So the Integrated Partnership Board goes through quite a detailed planning process, which we're right in the middle of at the moment, and that is working with health partners to draw up our programme for the coming year. The cycle is one of odd timing based around NHS England request for a programme, but then also in the financial year. So we need to pull that programme together over the next couple of months, and that will be this time a 2-year programme for the first time. So we're just in the process of doing that. So, but it will remain around those bullet points there. The sort of strategic priorities remain the same in that space, albeit that the projects that we pull into those priorities might change from year to year. The Wellbeing Board, as you can imagine, with 8 reporting groups, has a huge amount of projects coming up over the next year. So some of them are just highlighted here, but it really is a selection. So we will continue to work to support. So one of the areas that we have recognised there is a real tension and a difficulty or a gap is around people who have substance misuse problems, either low level or indeed higher level, and actually that their difficulty in accessing mental health services through there isn't an integrated pathway for those residents. So we'll be working on that along with health. We are expanding the Mind service, which I think we have brought here before when we talked about mental health, expanding our office. So we do quite a lot of work for our families from Hong Kong who are settling here in Wokingham, and we will continue to do that. And then to continue to develop our Friendship Alliance, which is our main sort of vehicle working in partnership with the voluntary sector for reducing social isolation and loneliness of older people, but also additional communities. So we're continuing to do that, but there are many other projects beside falling under the larger remit of the Health and Wellbeing Board. And to add, there are 2 priorities of the Wellbeing Board around children that, as I mentioned before, are not represented here. So just to bear that in mind.
We see a lot of good content, a lot of good projects, a lot of strategizing. Is there integration at the Bob level? This looks very place level. Would you say this is very place level orientated? Is there any crossover with Bob? Is there any learnings between Bob and ourselves, or am I barking up the wrong tree?
No, not at all. So I would say this is borough level. So there are place level priorities, and whilst we try to complement, that doesn't define our work. Our work is really defined for our residents' needs and our own demographic and our own understanding of our population, and that is different in each of the 3 boroughs within the one place of Berkshire West. So we work very hard to keep the priorities of Wokingham live in that discussion. That said, there are obviously overlaps. So some of the areas where we would be seeing issues and prioritising are similar. So for example, the reason that substance misuse and mental health issue, which is a priority in the ICS strategy, the reason that's there is because I wrote that bit of the ICS strategy, and I know it's an issue for us in Wokingham. So that was an area that we needed to champion for our borough, and there will be other elements in the strategy from others in that work. So there is overlap, of course, partly also because the ICS strategy for Bob was written by taking into account each of the strategies in each wellbeing board across the 5. So there is recognition of those priorities, because that's where the sort of the base documents were taken from, as well as the need being taken into account. But this represented here is very much a borough level, which is obviously not even place for us. So as a Wokingham representation, the WIP, the integrated partnership, is at local authority level, so not at place, but at local authority. There's 3 integrated partnership boards within Berkshire West. So whilst there's synergy, this is Wokingham.
Thank you very much for the answer. Thank you very much, Ingrid. Really appreciate it, as always.
No problem. And always happy to discuss anything further with anyone.
Yeah, no, that was super. And have a lovely evening with your children.
Thank you. Well, hopefully a quiet one. Thank you very much.
I know what two young girls is like, but not 3 young girls. And thank you very much, Wes.
Sorry, just to confirm, sorry, Chair. So you would like us to come back on the workforce strategy and the specialist accommodation project?
Yes, yep. And the numbers.
And the numbers, yep.
Yep. I think we're on to our last item, which is a health watch. So, but hopefully Alice is there. Are you there, Alice?
Hello.
Hi, Alice. It's good to see you.
Thank you. I mean, from the last time when we attended, we sort of shared with you about our work plan. So our next step is we've more or less achieved everything of our work plan. So we are now setting out, asking the public what is the priorities they would like us to look at. So that's going to be taking place soon. So we will be sharing that with you at the next host meeting. The other thing that we've also done, which I'm sure most of you who follow us on social media, you would have heard that we did an enter and view at Wokingham Medical Centre. So that report is going to be coming out soon. We had 150 people respond to our enter and view survey. So that report is going to be coming out soon. The other thing that we also championed was about the asylum seekers who were in those accommodation. And what has taken place is the integrated care board safeguarding team are going to be doing an assurance visit to the accommodation soon as well. That's also going to be taking place. And we're also going to be championing mental health, maternal mental health outcomes recommendations. So one of the things that Health Watch England did was a massive survey, which we were involved in around December, January time, and the report has come out that 30% of women were not getting their postnatal check done, and the question about mental health was not a priority. So we are going to be asking the public, especially mums, what was their experience and how we can make it better. So we're going to be asking the GPs services to find out why this is not taking place. So we're going to be championing that as well. The other thing that we've been involved in is the Building Berkshire together. So they came to Wokingham Cricket Club last week, and they showed what their plans were. And I would like to encourage Chair, that they come and speak to you guys about what their proposal is as well, because that will be quite good to understand if that is possible. And then, and so that's where we are at the moment. Thank you, Chair.
I think we have a question from Rochelle.
I was wondering if you would give the information to Democratic Services. I spoke to you, I believe, at that presentation, and the fact is that the two top places they want to for choices to move Royal Berks is either Shinfield in the Science Park or Thames Valley Park. Both of them are in Wokingham, and I thought it should be a good idea to bring it to this committee and to bring it to the whole council, since if we're going to have a large project, a more than £1 billion project occurring in Wokingham, and the idea of having new facilities, because the present facilities they have are rather limited. I went to John Radcliffe for something else this week, last week, and I can see the difference between that and what the Royal Berks can provide in its present location, and the fact that they have some problems with chalk underneath there, so they can't do anything. There's listed buildings, and we'd like to see, a new building that's made for this century, not for the last one, if possible, that has net carbon zero and all these kind of things put in. But it should be something that will be brought to this committee and to the whole council, because I was the only councillor that showed up there, by the way. No, you were there. I didn't see you, Jackie. I didn't see you. Sorry. That's why I didn't see her. She was behind me. Yeah. But it was a very good presentation. And it is something that's getting significant, interesting project for Wokingham.
It was a shame, actually. Only 20 people turned up.
Sorry, I was ill again.
Yeah.
Sorry, I meant to go, but
Okay.
I was ill.
They were also talking about using Wokingham Hospital possibly as interim care to get people out of the hospital that need a little bit of care but don't really need to be in a hospital bed, and they're bed blocking right now. So that's another project that's going to affect Wokingham. It's something that we need to look at. Let's put it that way.
I think
Very good point, Rochelle. Thank you. We've taken a note and we will ask them. Alison.
It's sort of a question for Health Watch and Rochelle and Jackie, and thank you for attending the meeting. I wasn't able to go. But do you think it wasn't promoted very well, so that, few residents knew about it?
I don't think it's promoted as well as it could have been. I happened to catch it somehow or another and get the email. I don't know who else they sent the emails to. They may have, but they didn't realize. I don't think most people realized what it was. It was also a night that several other meetings were on as well. Yes, and that's why I said that we wanted. That's why I said we should have one here for this group and also for the whole council, because it's going to be something that's going to affect Wokingham significantly. And since their top two places are both in Wokingham, we're most likely going to wind up with a new hospital and all the other interesting parts that go along with having a giant-sized hospital here. So,
can I just say?
Sorry, Phil, next.
I didn't know if Health Watch wanted to come back on my question about the promotion.
Well, I do agree with you, Councillor, that it was not promoted very well. I mean, I don't know who they went to, but eventually when they came to us, we tried to promote it as much as possible. But I know that council did promote it through the residents' newsletter. So, but just to share that they are going to be back after the election, just to share that.
Hi, Alice. Thank you very much for presenting to us tonight. Good to see you. Just a question actually about the specialist health support for people with learning disabilities. You say you're continuing to work with the ICB. My question really is this around conditions and support directly for people with learning disabilities, or is it about accessibility? Because I fear that actually accessibility is one of the biggest problems that there is with people in that area.
I do agree with you, Councillor, that it is accessibility, and this is something that we'll be looking at as well. But I think there's a lot of work that needs to be done, especially with the learning disability, to be fair.
And Beth, please.
Yes, hi Alice, and thank you for the report. Can I ask if you're going round other towns in the borough to look at what you looked at in the Wokingham surgeries?
A lot of the time that what we tended to do was the reason why we did the enter and view was based on what feedback we got. And so we had a lot of feedback about the Wokingham Medical Centre. However, my plan is the recommendations that we put forward for Wokingham Medical Centre, we are going to be looking at other surgeries to see whether that is going to be taking place or not.
One of the things that we have forward planning meetings for the agenda for this HOSC, and I keep bugging Madeline and Ingrid and everybody I talk to about the PCNs, the GP surgeries, which didn't turn up when we asked the GP surgeries to present, specifically Woking Medical Centre and Woos Hill, that we both have. I think a lot of people have anecdotal stories that there are service delivery problems in those two locations and their ratings are quite low. So I asked Ingrid if she could actually ask this question up at the highest level possible in the ICB to motivate these GP surgeries to come to present to us, because from my perspective, when there is a problem somewhere and you're getting a low rating somewhere, it's, perhaps we can help. Perhaps we can push the ICB to give a bit more funding or something. But unless we talk to these people, we can't find out what the fundamental problems are. So I'm hopeful that Ingrid is going to apply enough pressure to the ICB to get Woking Medical Centre and Woos Hill turn up to present to us. But in the meantime, I wanted to say thank you to Healthwatch for doing the survey at Woking Medical Centre. I think 150 people is a good turnout, and that should give you some decent numbers. And hopefully, we will get a nice report from you with some really nice anecdotes in it. Meaningful anecdotes, I mean, not just complimentary anecdotes. But thank you very much for that piece of work.
Thank you.
Belle.
I'd like to apologize to Jackie. I didn't notice you.
Alice, I think we've finished now. Thank you very much for your time. Thank you very much for your time, Ingrid. See you next time.
Thank you.
Thanks a lot. Bye-bye. There are one or two things I wanted to say. I went to an RBH Trust meeting, and the numbers, the chair of governors has been viewing these HOSC meetings and got the GP numbers from the Woodley presentation that we received, and he gave those to the RBH Trust chair and chief exec to give an indication of the kind of volumes that the GP surgeries have in comparison to ED or A&E, whatever you want to call it. So that was very enlightening that other people outside of our little bubble are actually listening to us and getting some value from some of the things that are being presented here. One thing I wanted to say about the RBH Trust as well, are very short of governors. There's supposed to be 29 governors. I think there are currently 19. So if anybody's particularly interested in health matters and RBH specifically, let me know and I'll get you in contact, and you can apply to be a governor. I'm not sure exactly what the procedure is, because I'm a governor through being a governor elected as part of the last May's election. So I didn't go through the normal process. So I don't know what the process is, but if anybody wants to be a governor, they can be, and it's quite interesting to see what's going on the front line of the NHS. Beth?
It's because I've got my hearing aids on, I can hear myself better now. I've just been elected as a governor, and I haven't been signed up for anything yet, but I don't know what it involves. So hopefully we'll report back through us, because Clive Jones is also a governor.
So are they daytime meetings or are they in the evenings?
I think they're at 5 o'clock, Alison, which is for me is insulin o'clock, so that should be interesting.
In terms of timing, quite a few meetings have been on Zoom. So if that helps, I don't know if that helps.
I wasn't thinking so much as myself, but they've only got 19 governors, they need 29. But there's a lot of people who would be interested, have lots of skills and talents, but they have jobs, and being able to be at the Royal Berkshire Hospital at 5 o'clock is difficult for many people.
I think it's very challenging for all voluntary organisations at the moment post-COVID. A lot of people don't seem to want to travel so much these days. You can claim expenses back, obviously.
About that, Chair, or just in general, because I do have a question for you, if you wouldn't mind. And Madeline, it's just really about the forward programme, because there were a number of things that we had discussed. Is that programme still going to be going forward? Obviously, there may be changes in the elections. We understand that, but HOSC still carries on regardless. Is that programme fixed and moving, or has that fallen away?
The forward programme, I had a discussion a couple of weeks ago, and I was trying to add a few more things into it. So it is going to be changing, subject to the election. Anything can happen. Obviously, you might have a different chair, for instance.
I mean, at the other scrutiny committees, we have had forward programme on the agenda, and we've been able to see the plan, and and there are there's a plan for the first meeting in June of what's going to be on the agenda. I don't know. I know Madeline's not well, and I wondered if that was part of the reason we didn't have the forward plan here today.
Sorry, yeah, the discussions have been going on in the background. As you can see, Madeline's ill. I've been ill for quite a long time. So unfortunately, this is something that's not been documented properly. I apologise, and but I think what I'm trying to do is with Phil's support, is make progress with Bob, which I think is important. And also, what I said to Ingrid as well is I want to really start understanding how all the other bits fit together, the wellbeing board and everything else. That's why we had a bit of an overview of the wellbeing board today. But because we have this link into Sarah Webster should have the power to get the PCNs to come and talk to us that we want to talk to us, like Woking Medical Centre. So I want to go around the side and leverage people to come and talk to us. I was ill for the presentation of the dentists, but the dentist report that I read was massively better than the previous dentist report. The previous dentist report wasn't worth the paper it was written on. So that was I had a meeting on that topic with Alison Webster and Suzanne, I can't remember her name, from NHS England. And I said, look, we're not getting the transparency at HOSC, we're not getting the numbers, we're not getting enough detail, we're not getting comparatives. And this Suzanne lady, can't remember her name, but she's a senior NHS England person. She said, we want to work better with the Bob HOSCs and we want to be much more transparent. So the next dentist report should have many more figures and graphs in than it previously did, and that was the case. So we did get some proper comparatives and etc. So I was pleased to see that, but they seem to be really open to being more transparent than they've ever been before. That's what they were saying. So I think that's quite good for this committee as a whole, whoever is chairing it.
We'll make a comment. I suspect, and you know that we've discussed this, I suspect that's because they are looking hard for funding nationally. They're looking hard for funding nationally. So obviously anything they can do to support their case is actually good for us, because it means that they will actually start talking about it.
Well, this is why I want Woking Medical Centre to come here and say, why the hell have you got all these problems? Is it funding? And do you need this committee or whoever to shout about the funding that you're not getting? I mean, per patient, they have 25,000 patients and it's pandemonium in there. Last time I went in there, it was pandemonium. Queues outside the door.
So will the agenda of the first meeting in June be sent round? Because we need to have an agenda, because it needs to be, we don't want to waste the first HOS meeting simply talking about its forward plan. Because I don't think we were able to look at the ambulance service this year. That was something that we were concerned about. And I think there were other things.
Yeah, please.
I would suggest that if there are items that are of your interest, that you write to Madeline and she can compile a list. And I'm sure she'll be organizing a meeting with the new chairman. And I'm sure a lot of this can be organized by email before the next meeting.
But I think the ambulance thing is still on her list.
Yeah, I mean, you know how we had the little list of things that weren't programmed in yet, but we had there were about 4 things.
Yeah.
But we all know how it's difficult to pin people down to invite them to the meetings. So I mean, we need to be inviting people and plan forward. So I just.
Yeah, but I mean, hopefully from the messages that I've given you, I want to shout for the WBC residents and for this committee. And, I want to shout at Ingrid, and I want her to shout at Sarah Webster, and I want her to shout at NHS England, so that we really get the right people in this room and we really get the right level of transparency in terms of numbers and outcomes, etc. So I think we we understand a little bit more about the ICB than we did a few months ago. And from the conversations I've had, which were limited to the chair of this committee, being me at the moment, the reaction was much more positive than I've ever heard before. Because, you know, the last time the dentist presented, I told the dentist guy, that's the worst presentation I've ever seen in my life. And it was, because I couldn't understand anything from it. You know, we're not at that stage anymore. I think we've made some progress.